I'm Sue Talakat from the Bloomberg American Health Initiative. Are you and your organization working to reduce overdoses, end violence, improve food systems, protect the environment, or support adolescents in the United States? If so, you may be eligible for a full scholarship to earn an MPH or DRPH degree at the Johns Hopkins Bloomberg School of Public Health. The Bloomberg Fellowship through the Bloomberg American Health Initiative can help you transform your career, support your organization, and make a significant impact on your community. Find out more at americanhealth.jhu.edu/fellowship.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, how one program in Washington state is mobilizing pharmacists to improve abortion access for early pregnancies. Dr. Beth Rivin is the CEO and president of Uplift International, an organization focused on improving health and human rights with a particular emphasis on family planning and reproductive rights. She talks with Stephanie Desmon about Uplift's groundbreaking Pharmacist Abortion Access Project and how it's creating more opportunities for safe, convenient, and effective care for women in rural and low-income communities. Let's listen.
Beth Rivin, welcome to Public Health on Call.
It's nice to be with you.
So, Beth, what is medication abortion?
First, let me say that abortion is a common experience for U.S. women. 1 in 4 women are expected to have an abortion by the age of 45. Now, medication abortion involves taking medicines to terminate an early pregnancy or first-term pregnancy. The combination of mifepristone, an anti-progesterone, and misoprostol, a prostaglandin, is the primary method of medication abortion in the U.S. in pregnancies through 77 days, which is 11 weeks and 0 days of gestation. Medication abortion has been used by millions of women in the U.S. since mifepristone was approved by the FDA in 2000. Medication abortion is the preferred type of abortion care, and it accounts for more than half, or 63% of all abortions in states without bans on abortions. Mifepristone works by blocking progesterone, a hormone essential in the development of a pregnancy, and it prevents an existing pregnancy from progressing. Misoprostol, taken 24 to 48 hours after mifepristone, works to empty the uterus by causing cramping and bleeding similar to an early miscarriage. Medication abortion is safe and highly effective as a method of pregnancy termination. The combination of mifepristone and misoprostol has an efficacy of 99.6%, and the risk of major complications such as hospitalizations or transfusion or infection is uncommon. More than 100 research papers in peer-reviewed journals spanning many continents in the world and decades have concluded that medication abortion pills are safe as a method for terminating a pregnancy.
How available are these? Does it depend on where you live?
The landscape continues to shift. Access to safe and legal abortion is under attack in the U.S. Currently, 23 states have banned or restricted abortion, leaving millions of women and adolescents without access to abortion care. Even in states that have legal abortion, like, Washington State, people still face barriers to care, especially people who are struggling to make ends meet, those who live in rural areas, or those who don't have easy access to reproductive health care. More and more individuals are opting for telehealth medication abortion. So even in states that have banned abortion, there are providers that prescribe to individuals in the so-called red states, those states that have banned or restricted abortion access. 1 in 5 medication abortion prescriptions are by telehealth now, and it looks like this number is increasing. Telehealth medication abortion provision is safe, affordable, convenient, and private. There's easy access to information about where to find medication abortion. Websites provide information specific to each state in the U.S. Sites like Plan C or abortionfinder.com and Planned Parenthood are some of the sites that provide this information.
So if I live in a state that has an abortion ban, I can still talk to a doctor in a state where it's permitted and get prescribed?
There are providers that are doing that, yes.
Is that legal?
There are shield laws that protect providers in certain states.
Mm-hmm. So and typically it's a doctor who's prescribing this medication, yes?
There are advanced practice providers such as nurse practitioners, PAs, midwives. So yes, there are other providers that are prescribing medication abortion in addition to doctors.
Mm-hmm. So your group wanted to expand that, and you've come up with the Pharmacy Abortion Access Project. And I'm wondering what's going on in Washington State where you are.
Engaging the pharmacist community makes sense. The pharmacists are an untapped professional resource in our current environment where access to abortion care is under attack and challenging for millions of individuals. With training, pharmacists are able to support expanding access to abortion care. Remember, pharmacists have a history of providing reproductive health services such as emergency contraception or Plan B, and also contraception. Before Plan B was over the counter in the 1990s, pharmacists were prescribing Plan B in Washington State. Then other states allowed pharmacists to prescribe Plan B. It all started in Washington State, where many rural communities don't have access to reproductive health services, but they actually have access to their trusted community pharmacists. And this is true around the country. Washington was the first state to allow pharmacists to legally prescribe medications. The state is an innovator in pharmacy practice. Since 1979, pharmacists in Washington have been authorized to prescribe FDA-approved medications and have safely and effectively prescribed medications to millions of patients. Pharmacists in Washington prescribe medications regularly, such as chemotherapy for cancer and antiretroviral drugs for HIV under complex protocols, of course, in coordination with physicians and other providers on a patient's medical team. Prescribing medication abortion fits squarely in the scope of practice of Washington pharmacists. They're legally considered medical health providers and are deeply integrated into the healthcare system here. My understanding is that about 40 states allow pharmacists to prescribe some medications. The particular medicines and procedures for prescribing by pharmacists are up to the state.
Let me go back to sort of why you decided to engage pharmacists. It sounds like pharmacists have been part of the medical landscape for a long time in Washington State.
Since Roe v. Wade was overturned in 2022 by the Supreme Court of the United States, the U.S. has been experiencing a medical, public health, and human rights crisis regarding access to abortion care, and Uplift responded by pioneering an innovative solution to this complex problem. The Pharmacist Abortion Access Project, or we call it PAP, PAAP, was designed and pilot tested by Uplift International in Washington State because it's the only state that currently allows pharmacists to legally prescribe medication abortion to patients. The project created a model that broke new ground. It was the first time trained pharmacists prescribed medication abortion directly to patients. I have been associated with the University of Washington for a long time, and I've been a faculty member for many decades. I know a number of folks at the University Medical Center and in the School of Pharmacy and Public Health, as well as medicine. And we started discussing possible projects in 2021, 2022, and came up with the concept of the Pharmacist Abortion Access Project. The pilot program is about a lot of things. 10 pharmacists in Washington prescribe medication abortion online for 43 individuals after reviewing medical charts. The pharmacists participating in the pilot program underwent training that mirrored physician and nurse practitioner training about medication abortion, including screening for patient eligibility, exclusion criteria, and counseling. The pharmacists successfully screened patients through an online portal and prescribed medication or referred patients to a clinic for an ultrasound or blood tests. Messaging through the platform was available, and prescriptions were then dispensed by mail using an online pharmacy. A helpline for questions was available for the individual patients. Pharmacists followed up with the patients 1 week after medication was dispensed and again at 1 month, and no individuals reported complications. And so it was our pilot project that created the training program and also developed the platform for the pilot. Mm-hmm. We now know that Washington pharmacists are willing and able to screen for and prescribe medication abortion online. In fact, we have just finished a survey of Washington pharmacists, and an overwhelming majority are interested in prescribing and dispensing medication abortion. We're now in the process of formalizing continuing education for pharmacists on the topic of medication abortion and upgrading the online platform experience to expand access to pharmacist prescribed medication abortion in Washington State. We believe this also paves the way for pharmacists to prescribe medication abortion in person at brick and mortar pharmacies. We know that there are some pharmacists who own pharmacies in Washington State that are interested in not only dispensing medication abortion, but also prescribing medication abortion.
Mm-hmm. If I live outside of Washington State, I won't be able to access Washington State's program, correct?
Our Washington State program currently will be fully legal, and that requires that only people residing in and having an address from Washington State will be able to get medication abortion prescribed by pharmacists licensed in Washington State. Our project provides a model that other states can follow, and we've already heard from organizations and representatives of other states who are interested in learning from us and having consultation. Some of the states are California, Massachusetts, New York, New Jersey, Maine, and New Mexico.
Mm-hmm. And what kind of impact do you imagine once this spreads throughout Washington State and perhaps beyond?
Well, we believe our pharmacist model has the potential to change the dynamics of prescribing practices among the estimated hundreds of thousands of pharmacies and pharmacists throughout the U.S. and significantly improve access to medication abortion for millions of individuals. This may take time, but we believe this is a game changer for access to abortion care.
And I guess in the year 2025, that's really important.
We believe it's extremely important. We see what's going on in the country currently, and the medical, public health, and human rights crisis is only getting worse for women and any individual who wants to access early abortion care.
Beth Rivin, thank you so much for joining me.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.